Hello friends, today we are going to learn about serratus anterior. So serratus anterior is the muscle which is present along the side of the thorax. So first we will see its origin, insertion, nerve supply and action. First we will start with the origin. It arises from the first 8 ribs by a series of 8 digitations. So as you can see, these are the first 8 ribs and these are the digitations from which it arises. Insertion, it is inserted into the medial border of the scapula. As you can see, this is the scapula, this is its medial border, so it is inserted into the medial border of the scapula along its costal margin, along its costal surface. So what is costal surface? Costal surface refers to the anterior surface of the scapula. So now, to be more specific, the first 2 digitations are inserted into the superior angle of the scapula. So as you can see, this is the superior angle of the scapula. The next 2 digitations are inserted into the medial border of the scapula. As you can see, this is the medial border of the scapula. The next 4 or 5 digitations are inserted into the inferior angle of the scapula. As you can see, this is the inferior angle of the scapula. So now we'll see its nerve supply. It is supplied by the long thoracic nerve, also known as nerve to serratus anterior, whose root value is C5 to C7. Now we'll see the actions of the serratus anterior. So its first action is protraction of the scapula. So protraction refers to the forward movement of the scapula. Therefore, it is also known as the boxer's muscle. Another action is maintaining a firm contact of the scapula with the thoracic wall. Another important action, it helps in the overhead abduction of the arm. It moves the scapula laterally and upward during this overhead abduction of the arm. So this action is also assisted by another muscle which is trapezius. So lower part of the trapezius and lower part of the serratus anterior will help in overhead abduction of the arm. So now we'll look at its applied anatomy. As you can see, the applied anatomy is the winging of scapula. So when this muscle, serratus anterior, is paralyzed due to any injury to long thoracic nerve, since it is supplied by the long thoracic nerve, if there is any injury to this nerve, due to removal of breast tumor or any other injury, it will lead to the following effects, such as protraction of scapula will be weakened since its action is protraction. So this action will be weakened and inferior and medial border of the scapula will become prominent. This is the inferior and this is the medial border of the scapula. It becomes prominent. Since its insertions are into the inferior and medial border of the scapula, that side will become prominent. And in patients, if the patient is asked to push against a wall, it will become more prominent. So this condition is known as winging of scapula, which is due to paralysis of the serratus anterior muscle. Thank you.